At the Lions Sight First Eye Hospital Eye Clinic section, several patients wait to be attended to. While some are visiting to have their routine eye checkup, others are here to seek medical attention due to eye complications. James Mutiso has been experiencing double vision and has difficulty seeing at night. After several tests, he is diagnosed with cataract on his right eye.
James, hii macho iko na shida inaitwa cataract, sijui kwa lugha yenu nyumbani inaitwa namna gani, lakini ni ile lenzi ya macho ile mtu anazaliwa nayo imepata kuchafuka. Ndio maana unakuta haioni vizuri. Ndio maana unatumia hii peke yake na nyingine pana ona vizuri. So ile recommendation napatiana ni kwamba tutakutengenezea hiyo macho yako ya kulia, alafu tutaona baada ya kutengeneza, alafu tuone vile itakuwa kama kesho. Tunaweza kufanyia operation hiyo cataract tutoe ili turudishe kwa uwezo wako wa kuona katika hiyo jicho. Hii operation ya cataract ni operation ndogo. Hatulalishi mtu, huwa tunadunga shindano kidogo kwa jicho hapa, inaganda kwa sababu unajua tutaki tufanye operation kama unasikia uchungu. Inaganda, alafu sisi wenyewe tunakusafia jicho, tunaweka lens nyingine mpya ndani ya macho ili upate kuona.
The clouded lens will have to be removed and replaced with an artificial lens implant for him to see with ease.
Shida yote ya pressure.
James is quickly booked for theatre.
Dawa zote za pressure ukitumia unashaitumia dawa zote za pressure.
Preparations include undergoing several tests. The medic further places eye drops in the patient's eye to dilate the pupil.
Jicho lake karibu dakika 5, alafu tunaweka tena kuna dawa nyingine pia tutamweka.
The oral medication is part of the anesthesia process.
Tukienda theater, zile vitu ametoka nazo outside theater huwa tunaziacha huko. We change the mask, we gown the patient.
We too get ready for theatre to witness the cataract removal surgery. In the company of Sylvanus Tenas taking care of James, we are taking him for the operation to remove his cataract. We can proceed.
This is James Mutiso, 56 years old, doing PCOL right eye. Daktari has already clerked him, his surgeon. He has signed the consent. I've given him Diamox 250.
James receives local anesthetics to numb the area.
The first injection is painful because the nerves are still intact, but the rest will be okay. I'll first clean. Then I'll put the first injection right there, pole mzee. Withdraw that you're not in the blood vessel, then you push. And pole mzee. Ayafunga macho. That is the first injection. Then we apply pressure to ensure that there is no blood coming out and the drug spread nicely, because this is usually a blind procedure, but with advanced technology there is use of ultrasound guided, where you actually get the target of the nerve. This one we target the optic nerve to ensure its number.
Inside theatre, Dr. Solomon Asacha is ready to attend to his patient.
James is ready for surgery. He has received anesthesia. So we just want to start the procedure of removing the cataract so that we allow him to go home. So we normally stabilize the eye by putting what we call a superior rectus suture, just to make sure that the eye is stable, so that during the procedure everything is good. So that's what I'm doing at the moment. I'm stabilizing the eye just to make sure that it remains in position as we continue with the surgery. So we are ready. So normally through a small incision through the eye, we have to get inside the eye and see how we can maneuver and get the cataract out. So for now I'm getting the conjunctiva out. That is the conjunctiva to allow me get it in the eye. Then from the conjunctiva I have to make an incision on the sclera. Please put out on the cornea. I'm just putting a small incision on the sclera to make an entry into the eye. I'm doing what we call tunneling. Cataract is the definition for an opaque lens. You know the lens is supposed to be clear. That's why you can be able to see a good image on the retina. So the lens is supposed to be clear. So anything that causes a lack of clarity as far as the lens is concerned, we call it a cataract.
The cataract removal surgery takes approximately 10 minutes.
And as you can see, the cataract comes out gently like that. So the next step is to put in what we call an artificial lens, and then we'll be done with the operation. Yeah, it will feel better, and it stays there forever. If it's an inert thing, it does not have any reaction. It has been tested, so it will stay there forever. If there will be any compensation, maybe requires something to enable him read in terms of glasses, we'll do that after 2 months from now. Yeah, because we need the eye to heal completely, then we can do that. Once we've done the surgery, the eye is supposed to be taken care of just to avoid infections. The medication they need to put on frequently, Alexis, they're supposed to use frequently just to avoid any secondary infection and to ensure that healing is faster.
The process is complete and James will be allowed to rest in the ward for a review the next day. He will be allowed to go home whole again. Thank you so much for joining us on this episode of Your Health. We are coming to you from the Lions Sight First Eye Hospital. We talk about, eye care. We are joined by an expert from this hospital. His name is Dr. Asacha, and thank you for joining us. We just want to begin with the basics, the eye, the window of the body. Maybe you can tell us what does the normal eye look like and what are some of the functions of its parts?
Yeah, this is a model of a cross-section of the eye, which is giving us the structures right from the front part up to the back. Normally, this is what we call the cornea. People talk about being black, but it's not black. You realize it's a clear kind of glass that normally acts as a refractive media for the eye, because once light rays hit here, they are now refracted, and you can actually be able to form an image on the retina back here. So the cornea plays a critical role as far as the refractive media of the eye is concerned. Apart from this cornea, as you can see, apart from the cornea, this is the front part of the eye. We have structures like this white part we call the sclera, which is made of fibers. It's normally the thickest coat that also prevents eyes from, maybe if you have an injury, it is very, very firm. So it prevents the eye from getting any perforation and all that. But depending on how the injury is, it can also perforate it. So it helps to maintain the integrity as far as the eyes are concerned. Apart from that, you see there are these on the sclera. These are we call the insertion of the muscles. There are muscles that normally move the eye, either up, sideways. Like if you want to turn, if you're using your side mirror, you're driving, that you turn your eyes. There are the muscles that control the movement of the eye, so that you can actually be able to focus together. Some people are born with disorders of this muscle. They can be weak, and that's how people get maybe squint. Sometimes these muscles can be paralyzed because they are normally supplied by nerves. So sometimes they can be paralyzed, and you find you need treatment for that. So apart from the muscles and the sclera and the cornea, as you get us inside the eye, we have a place between this iris and the cornea, which we call the anterior chamber. that normally has a fluid that we call aqueous, which is released from what we call the ciliary body, that normally regulates the pressure that is in the eye. That's what I was talking about in glaucoma. So if the pressure is not, that pressure is not regulated well, it now causes pressure on the optic nerve, and you can actually damage the optic nerve. And this optic nerve is the one that now connects the eye to the brain, eye being just an elongation of the brain. So if you cut here, if you cut this optic nerve, you've actually cut the communication between the eye and the brain.
What could go wrong with the eye? You know, what are some of the common illnesses, disorders that affect the eye?
Although the eye itself has a mechanism of trying to make sure that it prevents itself from these infections, in terms of right away from the lids and in terms of how the eye structure is built. So yes, despite having a defensive mechanism for the eye, but you realize that the body is still susceptible to getting some of these eye conditions. And currently in Kenya, we are looking at about the major blindness being caused by cataract. We have other leading causes, although I might not have the figures as per now, but cataract being one. But the goodness with cataract is preventable. Through surgery, you can actually be able to regain your sight. Apart from that, we have what we call glaucoma, which in layman's term, we are talking about the pressure that is in the eye that causes damage to the optic nerve. The one thing that is a bit alarming as far as glaucoma is concerned, glaucoma causes what we call irreversible blindness. We are talking about reversible blindness that you can actually be able to reverse in cataract. But now for glaucoma, you are talking about reversible, because once those pressures in the eye have damaged the optic nerve, you can actually not be able to reverse whatever has happened in that eye. So glaucoma is on the risk, and the only way you can actually be able to mitigate in terms of glaucoma is trying to do what we call contact tracing, because some of these diseases have familial hereditary preponderance, such that if a family member has glaucoma, you need actually to screen siblings and other family members just to see if you can contact trace and be able to intervene. Apart from that, we have what we call refractive errors, which are undetected. You realize that there are so many school-going children who require spectacle correction for their vision. So if these refractive errors are not detected in time, you find that our children who are going to school, they can actually not be able to see well. And that's why, like our institution, we are reaching to what we call Sight for Kids, whereby we go to the schools and screen them and be able to detect that. Apart from that, we have what we call trachoma. Trachoma being an infectious disease. And normally trachoma is widespread in areas where hygiene is a problem, like in the pastoralist communities and all that. We've seen that. But the goodness with trachoma, with what we call mass screening and mass chemotherapy, they can actually use antibiotics for it to be cured, because trachoma normally causes what we call corneal scarring. If you don't take care of that, of the infection early enough, it affects the cornea, and once the cornea gets scarred, you cannot be able to see. Apart from the infections and disorders I've talked about, we have issues to do with the injury to the eye, trauma, people having to fight and all that. So any injury to the eye can actually lead to the structures of the eye getting damaged, and that one can actually also lead to blindness.
And these conditions that you're talking about, do they have general symptoms, or how are you able to identify, you know what, I think I have a problem, or even a loved one has a problem with their eyes?
Yeah, the early signs. Normally, somebody who has been seeing well will tell you is not seeing well. Maybe some of them will tell you they are having painful eyes. And you see, when they're having painful eyes, you have to really ask, was there any injury, or the pain just started? Is it one eye or both eyes? Because different disorders present differently. Something like cataracts, they don't actually present with pain. They'll just tell you that, like when there is mist, that's how they're seeing, when they were seeing very well. So depending on the condition, they can actually be able to come with those symptoms of like eye pain, not be able to read small prints. Some of them come to the clinic, they want reading glasses. But when you examine, you find something more than whatever they're actually looking for. Some of them will come even with the symptoms of systemic diseases. Somebody will come like having a lot of, taking a lot of water, which are sometimes symptoms of diabetes. So when you examine the eyes and you find what? When you do your clinical examination and even request to have your blood sugar checked, you find the sugars are high. But somebody had actually come with eye symptoms and all that. So there are those various symptoms. Some of them will even come with what you call double vision or what you call diplopia. The parents will come in with the children, they tell you that the eyes are also not straight, whatever we call squint and all that. So depending on the condition and depending on the symptoms, you can actually be able to do what? To interrogate further after taking the symptoms and examine the patient and come up with a likely diagnosis and be able to manage.
We're talking about cataract, we are talking about glaucoma. Do we have causes for this or predisposing factors, if you may say so?
We might not have, we might have what we call predisposing factors that leads to people having issues with the eyes. As I said, uncontrolled blood sugars can lead to such like problems. People have high blood pressure. We have people who are smokers that we tend to, as much as possible, to do what? To discourage smoking. Also, excessive alcohol consumption and all that can also lead to that. Apart from that, also, as I said, the environment that we live in terms of hygiene and all that. So it can actually be able to cause some of these eye disorders. Apart from that, we have other what we call systemic problems. Somebody who has another problem in the body can also present with eye symptoms. People like patients who have arthritis, they tend to have so to complicate as far as the eyes are concerned. So you can actually be able to dig in depending on how a client presents to be able to know what are the possible causes. And as I said, we have infections which are there inside if the body cannot be able to contain the infections, then we have what we call inflammation that come because of the environment and all that. Then you have issues to do with the trauma. And some of other disorders are also familial, or what we call hereditary, that are passed on from parents to their children and all that. Some of them run in the family.
So what are some of the treatment options available? I know you're talking about cataract being the leading cause of blindness, especially here in Kenya. Are the treatment options specific to the conditions?
We have treatment options. We have what we call medical therapy for different conditions. Depending on how you do an evaluation as a clinician, what the patient is having. Apart from the medical therapy, which could be maybe oral, through the mouth, or what we call the drops that you can put locally, or sometimes even give injections around the eye. Apart from that, we have surgical, those conditions that require surgical, which don't require medical therapy. And depending also on the type of surgery, you can actually be able to plan whether the surgery is elective or an emergency, you can actually be able to do that. Apart from that, we have also laser treatment. Lasers, those are initials, whereby you use light rays or beam of light that's normally controlled, not just any light. There's a bit of protected laser beams that can actually be able to correct some other conditions, like people have refractive errors, people maybe cannot tolerate glasses, they want to have laser done, you can do that. Apart from laser, we have what we call combined therapy, whereby you can actually use medications and surgery together, depending on how the condition is. But by and large, if you have an eye condition and you seek medical attention early, you can actually be able to prevent all this.
What are some of the prevention measures for these common conditions that affect the eye?
Normally, if you pick up any condition early enough, you can actually be able to mitigate. The only problem that we have, there are some conditions, when they present late, you might not be able to reverse whatever has happened. But that's not the end of life. We try as much as possible to stop further progression as far as the conditions are concerned. As I talked about glaucoma, you realize that glaucoma causes irreversible blindness. So when you get a client who comes in with glaucoma, you might not be able to restore the vision that is lost. But you try as much as possible to stop that further progression. And that's why you bring in the family members for them to be screened. If you pick them early, then you can actually be able to mitigate. Apart from that, the people who have like issues to do the refractive errors, what you call short-sightedness and long-sightedness, if you pick it also early, especially in children, you can give corrective glasses and you do what the children do well. There are those ones who require medical therapy. There are those ones who require surgical and laser. So depending on the condition and how advanced the condition is, you can actually be able to prevent and restore vision.
You mind leaving us with a few tips on eye care?
Eye care tips, currently, you know, the eye is we call it the window of the body. And when your eyes are good, you live a good life. I'm not saying that the other senses of the body are not important, but you see, the eye coordinates most of the functions of the body. If your eyes are good, you can actually be able to lead a good life. So we encourage people to eat a good normal diet, which is not universal. So you see, like we live in different economic times. So a balanced diet, you can actually be able to prepare from the foods that you have, which you can actually be able to afford. So that you also eat in the required portions and all that. Apart from that, as I said, regular eye checkup is very important. We request for, even if you don't have a problem with the eyes, to go for a biannual checkup. Every 6 months you can have your eyes checked. Because if you check your eyes, you can actually be able to pick up something that is not right. Apart from that, anytime you feel uncomfortable as far as your eyes are concerned, kindly come to the hospital. People have had a tendency, when you have a red eye, you go to the chemist and you'll be given a medication, then you are told, when it persists, go and see a doctor. So some of people come when already they have taken medications and they have complicated. So it's always good to have an eyes checked, because the eye is very, very sensitive. So you don't just use medication without having prescribed. But we see most of the patients come when they have already self-medicated themselves. Apart from that, as I talked about issues with smoking, it's good if you are smoking, you quit smoking, because smoking has an effect as far as your optic nerve is concerned. Apart from that, what we call excessive also take consumption of alcohol. You can do it in moderation, because if you don't do it in moderation, we have long-term effects as far as your eyes are concerned. You've heard of people who've taken methanol instead of ethanol, and the methanol normally damages the optic nerve, and it causes total blindness. So we might not do much about it. So if you can actually be able to have health eating habits and go for routine eye screening, you can actually be able to take care of your eyes well. Apart from that, we are living in what we call the digital world. And the digital world, because COVID has taught us so many things, people are spending most of their time on the computer. And when they spend so much time on the computer and the gadgets that we have, the electronic devices, they get a lot of eye strain. So we just request that if you are having issues, if you have sensitive eyes, come to be checked. If you feel you need something to protect you from excessive UV light, we can actually be able to prescribe.
I hope you have learned so much and enjoyed this episode of Your Health. I'm Purity Museo. I'll see you again next week. Enjoy the rest of our programming.